right. Welcome to the Dental Implant Guide Podcast. My name is Dr. Evan Pivetz. This is our first episode, so I'm going to go a little bit into what this podcast is and why we are making it. So I am a dentist in Columbus, Ohio. I have a clinic that focuses specifically on dental implants, specifically full arch dental implants. And I wanted something to help educate my patients a little bit further on the dental implant process. When someone's at our office, they get booklets, they get pamphlets, we have videos, we talk to them. But I just want more resources for my patients to kind of answer the questions they might have either before they come in, after they've come in to see us and they just have additional questions, or even if they're in the middle of the process and they just want to kind of refresher on what's next, what's going to happen. So that's kind of the main reason why I'm making this podcast. But the other side of it is there's a lot of people out there who might watch this who are never going to come to Columbus, Ohio and get dental implants from me. And that's completely fine. What I want them to do is if someone watches this podcast, I want them to be kind of armed with knowledge so that they can go to any clinic, they can go to any doctor, and they can kind of know what to expect. Have answers to some questions because there's a whole lot of people doing implants, a lot of people doing full arch out there. And I want people to kind of broadly have the knowledge to go out and be well informed when talking to anyone that could be doing it. So that's kind of a little bit about that. So for today, I have as my guest my office manager, Matt.
Hello.
For my patients who have been in my office, you'll know Matt's kind of my right hand at the office. He does a lot in kind of managing our patients through the process. So he has a pretty unique view on kind of the questions patients are having, questions patients are coming in and asking him. So Matt's got a long list of questions for us that we're going to kind of go over and try to answer to the best of our ability, just to kind of help you guys out there know what to expect when coming into a dental implant office. So thank you.
You're welcome. I think one of the first questions that we've always get is obviously cost, but the most important thing is, am I a candidate for implants? And sometimes I have to help our patients swing back around and realize that they may not be a candidate for implants. So I want to get to know my patients. I want to know what's motivating them, what brought them in at this point, what's changed in their life. And that varies because we do single implants, we do bridges, and of course we do overdentures and full arch. What brings people in? It's something in their life that's changed.
Yeah.
Something that's become very much important to them at that point. Whether it be they want to bring back the smile that they once had, and they're embarrassed. They don't like to have their picture taken. They don't like to be around family members. And that really hits hard. Or are they in pain? Do they have very bad periodontal disease? Is eating difficult for them? Have they gotten to a point where they're chewing on only the front teeth and not able to eat what they really want? So there's a multitude of reasons that bring people in, but the most important question is, are you truly a candidate for implants? And that's where we work together with the x-rays that we take to make sure that they've got the proper bone levels for implants. And not everybody is.
Yeah, and one thing I'd say more often than not, if we're saying someone is not a candidate, it's not because we can't do the implants. It's because they actually have enough teeth, good bone levels, that they might not even need the full arch implants, right? There's not many people that walk through the door that we cannot do the case, but there is a good amount of people, I'd say, that we turn away or send for another consult just because they have some longevity left on their teeth. And I think people get to this point where they're they don't know what to do. They don't know who to turn to.
Right.
They're just looking for someone to kind of tell them what they need to do. That's really hard as a dentist because I can't tell someone what to do, but I can kind of point them in a direction and say, hey, like, you're missing a few teeth. Like, you maybe have a few cavities, maybe need some root canals, but you're really young. Yeah. And, full mouth dental implants might not be the best option at this point in our life. And I'm never going to say no to someone if they we're going to have that conversation, but there's a lot of people that we send off to get other treatment done and say, hey, like, let's
see when you really need us.
Yeah. And I think that's more often when someone is not a candidate, what we see, right? There's very few cases with the implants that we do that we can't do implants if we need to.
Very true.
But, not everyone needs implants. And that's sometimes a hard discussion that we have with people.
But at the same time, we've had many patients who were pleasantly surprised and pleased that they were given information that's helping them to go in a different direction.
Yeah.
And they're not, in explaining to them why they're not ready for it. I've seen the light bulb go off many times, and that makes us feel good.
Yeah, I think it's important as, medical providers, we're not shoehorning everyone into one treatment, right? Having an office where we can offer multiple different things to people, but also having an office where we can say, hey, we're not the correct office for you. I think it's hard because there's offices that they'll do whatever you want, right? And they will take your money and do it, but it might not be the correct treatment. So definitely, I think it's important for people to know if they're a candidate in that sense.
And another question that I get occasionally, I'm too old. Well, it's more of a comment than a question, but I'm too old. And we've placed implants on 81-year-old, 92-year-old individuals.
Yeah.
You're only as old as you feel.
Yeah.
And with the people who are living so much longer, it's enjoy the time that you've got left in your life. And, be able to do the things that you really want to do. When you go on those cruises, be able to eat whatever you want off that buffet type of thing.
Yeah. I think, that is something we hear a lot is I'm too old. Is it worth it? Right. And I'm like, even if it's 5 years, and I don't know how old people are that are thinking that, but even if it's just 5 years, I'd rather enjoy those 5 years than kind of be miserable.
Right.
Wearing a denture or wearing nothing more often than not. Age is not really a factor when it comes to can I place implants, right? We can do it. I think it's more of a factor in what the patient believes is worth it. But what I can say is, all ages, when they typically get implants done, people are happy with it. People, are able to chew and eat stuff they couldn't before. And
right.
I think a lot of people maybe just have been in dentures for so long that they don't remember what that's like. But I don't know. I try to tell people, like, you're not too old, and I would rather enjoy the time that you have than kind of be miserable.
Very much so. A big part of what I do for our patients, is be their advocate, to help them work their way through the steps and the process. This is, for a full arch, you're looking at 4 to 6 months of a patient's life, and we get to know those patients very well.
Yeah.
And it's always a little bit sad when we finally complete treatment on them, and we know that we're not going to see them again until they come in for their 1 year, 1.5 year checkup. But there's a lot of steps. There is a lot of things that have to be done, and my biggest part is to advocate for them and to help them achieve what they want to achieve. What do you want? Where do you want to see yourself in another 6 months?
Yeah, absolutely. And I think having that, one office that people go to, I think that in implants and, full arch dentistry specifically, that's kind of the way things are going. The one office, one team approach, but there's still a lot of people who bounce around different offices to get this treatment done. And that's the way it was done for a long time before this kind of more modern approach to it came about. But when I see that, it's always, one, who's quarterbacking that? Is it your general dentist? Are they checking up with the oral surgeon they send you to? Is there a third dentist, a prosthodontist involved? Like, it's a lot of bouncing around. It's a lot of different doctors, a lot of different teams that you either get used to or only see a couple times until you move on to the next office. I think that, people obviously come here because I'm the doctor, but I think people enjoy their time here and stay here because of the team, right? It's not, it's not all me. It's they get used to you. They get used to our dental assistants. They get used to seeing the same people each time.
The
consistency, yeah. And so when you're at one office kind of getting this all done, it's a huge part of someone's life. They're spending 6 months with us. They're spending a lot of time sitting with us, talking with us. I think it's incredibly important that people get to know us and kind of get to know our team and get comfortable there, because it's going to be a lot smoother with that. They're going to not feel afraid to tell us anything, or if there's, small changes they want to make, they're not going to be embarrassed by saying that. I think building that with one team is incredibly important.
Yeah. And I came to you with years of customer service experience, not just management. And that's always been incredibly important to me. Help the customer, help the patient as much as you possibly can to make the best decisions for themselves. And that's the way I've always operated. And I firmly believe in that. And that's what I offer to our patients.
Yeah, absolutely. I think it's incredibly important. And I think that trust aspect, more than any, certificate I can hang on the wall, saying what I can do, the trust in me and the trust in the team is why people pick an office, right?
I agree. Very true.
All right. What other questions are you hearing out in the field?
Obviously the how long, what if, and we go back and forth with our patients, of course, and do their medical history and help them to understand everything that they're doing or they have done may affect the implants. What to expect.
Yeah.
And I've often, when I'm telling people that you're going to be on a liquid diet for 1 to 2 weeks, I get this look of, oh my, I can't do that. I'm going to starve to death. It's like, no, you're not. And it's not just a liquid diet. I just don't want you tempted to chew.
Yeah.
Well, we get those implants in there and happy with the bone structure.
Yeah.
That's easy to overcome, but it's that look of what you're in the headlights type of thing.
Yeah. What we tell our patients is, we have that 1 to 2 weeks of liquid directly after surgery, and that's honestly after surgery mostly what people feel comfortable going with anyways. And then after that, it's plastic fork diet.
Yeah.
If you can cut it with a plastic fork, you can eat it. And we had a patient, what was it, yesterday? Ask us what kind of plastic fork.
A good plastic fork or a cheap plastic fork.
We said a Costco plastic fork. You don't have to use a Walmart plastic fork. So it can be a Costco plastic fork, but try to keep it on that softer diet. And that's just while everything's healing up in there. We're playing it safe. We're making sure we're not putting too much pressure on those implants, those healing teeth.
We want to set them up to succeed.
Yeah.
We don't want failure.
Yeah.
For anybody.
Yeah. And I think that's important to talk about is, a lot of people, dentists, a lot of offices you go to won't talk about failure ahead of time, right? It's something that I talk about with every single one of my patients before we get in there. But implants are a biological medical procedure. They have a 90 to 95% success rate, which is fantastic. But that means that there is a period of time where implants don't integrate. We put an implant in and it does not attach to the bone. Normally we'll see that between 3 weeks and 2 months, that kind of early failure. And we're not talking about, 10 years down the road, something failing. We're talking about early on, where, I think offices should be talking about it is, if the dentist you're going to has kind of planned this case correctly. I always tell my patients, I always leave myself an out, right? I always have,
which you do.
I always have a spot to place another implant if anything were to go wrong. And I tell them it's a quick procedure. I take an implant out, I put a new one in. We get you new teeth. You're not going to be in a denture for a period of time. We'll reload teeth onto that. But that's planning, right? And that's my patients knowing ahead of time, like, this could happen. It's very unlikely, but it could happen. And if it does, we have a plan and we'll take care of you. Where I think trouble comes is, this idea that you're selling a full arch case and you're told this is perfect and permanent and, nothing's ever going to go wrong. And then if something happens, because it's not just a mouth, it's a person that it's attached to, there's factors, it's a medical procedure. So if something does go wrong and patients aren't told that that's a possibility, it's the end of the world, right? And I get that. If that's what I was expecting, it would be a huge thing. But I I think it's important that, for anyone listening, that is a possibility, and it's something that your dentist should be planning for and should have plans for as they're doing that case. So I don't want to hide it. I don't want to shroud that in mysticism of,
Right.
everything I do is absolutely perfect. I never have any failures. If you talk to enough dentists that do this procedure often, a common saying between us is if a dentist tells you they don't have any implant failures, so they're just not placing enough dental implants.
Yeah.
So
It boils down to being honest and
Yeah.
truthful with our patients.
Yeah.
And that's important for every one of us in the office, is to not try to cloud things over or keep them from what they need to know.
yeah.
Because it is a medical procedure. This is not, going and buying a pair of sunglasses.
Yeah. Yeah. And I think on the same vein is that something that, we talk about in our office, but bothers me is the idea of calling full arch dental implants permanent, right? It's something that we don't do because, saying something is permanent means a whole lot to a whole lot different to a whole lot of different
Right.
people, right? If you're really young and I tell you this thing is permanent, you're expecting it to last 40, 50 years. And, you go get a hip replaced, they're not telling you it's permanent,
Nope.
right? It's, this is the average life expectancy. You might need a revision at some point. And we tell our patients
Right.
that every single one, hey, if you're younger, 15, 20, 25 years, that's kind of where that literature lies of the average of how long these can last. And I tell them that up front. I know you have implants that are 30 plus years old.
Way too long. Yeah.
And we use that as an example. They can last longer. I'm not saying that. But what I'm saying is that calling it permanent is, I think, a bit of a misnomer, because then same thing. If something goes wrong, well, these were permanent. Well,
What's changed in your life, though,
yeah,
too?
yeah. So much can change in a patient's life medically that can cause problems. I've never liked calling these permanent. And I think that in a sales environment, calling them permanent teeth is pretty common. And that's kind of one of my pet peeves.
And it's not being honest.
Yeah.
Plain and simple.
Yeah.
And not to put too fine a point on it. And the other question is, how do I care for them?
Yeah.
What do I have? What do I brush these? Do I? And of course, that changes over the course of the whole process of going from your healing teeth to your zirconia finals. We always joke around about how water pick is going to be your best friend.
Yes. Yeah. And I think that's another factor in the longevity of this is,
Very true.
are you cleaning it? Are you taking care of it? Matt's right. A water pick is our
best
patient's
friend.
best friend. They have one at home. A lot of people have a travel one. They bring it with them. But taking care of these is incredibly important. And, getting teeth out and getting implants in is not then, oh, I don't have to care for it anymore.
Yeah.
I tell my patients, you care for this just like you care for your normal teeth. You're taking care of it every single day because we want it to last as long as possible.
Yeah.
I think an important thing to talk about probably would be the process. If someone's, watching this and they don't even know what this process is, some of what we're talking about probably is
Foreign.
Yeah. So what I can talk about a little bit is our process specifically. So if a patient comes in to our office, the first thing they're getting is a consultation. In our office, it's a free consultation. We include x-rays. You'll talk to me. You'll talk to Matt. We include all that free. It's going to be different at every office. It's just for us, we've found that that's the best way to get someone who might need our help in the door. So you get that free consultation. If you're a candidate for full arch dental implants, the next step is the smile design appointment. They come in. Again, at our office, we take 3D scans, we take pictures, we do everything because we're completely digital as an office. We can get into that later, but there's some old school methods that a lot of people still use. We utilize technology, completely digital. So we have everything pre-planned before that surgery. So a patient would come in, get those implants in. If there's teeth, get those teeth out. If there's infection, clean that infection out. And then our goal is within 24 hours of that appointment, that patient gets teeth screwed onto those implants.
Right.
So a full set of teeth screwed onto those implants, doesn't come in and out. And during that healing phase, like we talked about, the plastic fork diet, they're going to heal for about 3 to 4 months with teeth that aren't coming in and out. And, traditionally how this was done is someone would be in a denture, someone would get some bone grafting 6 months, 8 months, 9 months in that denture. And, that's how things used to be done. But, using kind of modern technology, advanced placement techniques and stuff like that, our patients get teeth screwed in. Yeah. And then after that healing period of about 3 to 4 months is normally when they get their final teeth. That's that strong set of teeth made of a material called zirconia. Yep. There's a couple different materials that finals can be made out of. We use zirconia. I find it the best, but we see some different stuff come through the office every now and again.
True.
And yeah, so that's kind of the whole journey boiled down into a short nutshell for people.
And that initial consultation is our effort to be able to answer any and all questions, concerns that the patients have. Mm-hmm. And I always make it blatantly clear there's going to be adjustments. Mm-hmm. What your mouth is like on the day of this procedure is not going to be the same in 3-4 weeks. So as you heal, we're going to have to make adjustments. That's to be expected. And in that way, they're prepared for it, because as we've kind of intimated at the beginning, this is a process, a 4 to 6 month process that they're very involved with us and we're very involved with them.
Yeah.
And of course, if anything comes up and they need to see us, we're going to get them in. That's a given. We never don't take care of our patients. And it's interesting that, it's the healing teeth that we utilize to minimize the impact on those implants until they are fully integrated into the jawbone, whereas there are other companies that want to get them into their zirconias right away.
Yeah, and that's a very, I think, popular, trendy thing in
good word
full arch in dentistry right now is, we say 24-hour teeth, we mean 24-hour healing teeth, and some people mean 24-hour teeth. You're done after that. You get your finals. You maybe have a post-op afterwards, and you're done. And I don't agree with that. We have someone near us that does something similar to that, and we get patients from there. But what I have seen and with my patients is, that 3 to 4 month healing, there's a lot of changes that happen in there. The gums change. The structure of everything changes. Normally when we hit that 3-4 month mark and we're making those final teeth, we're making adjustments to it, right? It's not a exact carbon copy. We're making changes to make it better. And so if you're getting your final teeth 24 hours after that,
you're done.
You're done. There's not a lot of changes you can make. And if they are, they're, I would say, inadequate changes, right? They're having to add stuff to zirconia, which you can't really do effectively to try to fix any gap that might be in there. And, you'll hear, oh, we do the case in a way so there's no change between that. But I just, in my experience, it doesn't end up that way. I would rather take my time. I would rather be patient
with our patients.
Give the body time to heal so that we're not rushing the case. My goal is not to get someone in for surgery and out and then, not see them again. Right? Like I want that patient to be patient. I want to take my time. I want to make sure the case is done right. And I just feel that, it's a little bit of a rush to try to do teeth in 24 hours. I don't see the reasoning behind it besides that. It's just, for a patient, I understand, right? There's an allure of being done after 24 hours. But I would prefer to do it what I see is right. Do it in a way that I am making sure that final prosthetic is as good as we can make it.
And they're happy with it.
Right? I don't want to see teeth in 24 hours and then them come back, I'm unhappy. Well, sorry, we already made it, right? So that's my take on it. I think it's popular right now and something that, certain places are trying to do. But I think that giving the body time to heal before seeing those final teeth just seems prudent to me.
Very true. Another thing that so many dental patients have extreme anxiety for any number of reasons. And I mean, we hear horror stories of people who were held down by dental assistants when they were kids, and the dentist continued drilling even though they weren't numb. They're embarrassed because the condition of their teeth, so they haven't gone to the dentist in years.
Yeah.
Any number of reasons, whatever reasons. They've watched too many horror movies. So we get questions about sedation options.
Yeah.
And our office is well set up to offer 3 different levels of sedation. And you want to discuss that and talk about how that
I think
patients.
Sedation is a big thing in this procedure, right? And there's a whole lot of different ways to do it. We kind of offer the full gamut of options. For someone who's not really nervous at all, they can just do oral sedation, take a pill, feel calm and comfortable. And there's some offices that's all they do. But we like to offer a little bit more to people if they need it, because most people need it. We offer an IV moderate sedation, which I describe as kind of like a twilight anesthesia for people who have had outpatient procedures. And I think the important thing to note for that is we bring in third-party CRNAs, nurse anesthetists, to help with us.
Constantly monitoring vitals.
It's very common for offices, the doctor to do the sedation and the surgery. And there's nothing wrong with that, especially if it's a shorter procedure. But I have tried, and when you're getting into those longer full arch dental implant procedures, I just think the patient is safer, the surgery goes smoother, everything works a little bit smoother to have a third-party person there to help, right? I get that we can do sedation on our own, and there's nothing wrong with that. But in our office, I feel like it is a very comfortable workflow to have a third-party nurse anesthetist there to constantly monitor the entire time
and adjust meds and all that.
Because it's a big job doing sedation. And I would prefer not to split my brain in half while I'm doing surgery.
I like that.
And then the last thing that some people need is full general anesthesia. I say it's hospital level sedation.
Right.
We bring in an anesthesiologist, and they put patients completely under for the whole procedure. And that's, obviously our most comfortable option. The IV moderate is very comfortable, but you're kind of in and out. You're not going to remember the procedure, but for some people, they won't walk in the door without knowing that we can put them out. So we have that as well. And so for anyone who's going to a dentist, find out what kind of sedation they have. It's important. It's important to know what that's going to look like. I don't want people showing up and not knowing what kind of sedation they're getting day of surgery.
That's why we cover it as thoroughly as we possibly can. And, going back to the general hospital level anesthesia, there are other reasons other than anxiety that somebody may need that, other physical issues. This procedure can take 3-4 hours.
Yeah.
And, if they've got back issues, breathing issues, there are lots of other things that can play into it as well. We want to make sure that patient's taken care of as well as possible.
Yeah, and I feel like that's pretty common. If someone has those comorbidities, we need a little bit more level of monitoring and a little bit more level of control during that sedation. Moving to a general anesthesia is really helpful for that. So there are people that we kind of move that route, not because of nerves, but because of a higher level of safety if it's needed.
And it's interesting, Doc, you'd mentioned earlier about my implants, and I've got 4. I've got 2 that were placed quite a long time ago. And back then, yes, my dentist sent me to one oral surgeon to do the extractions. Then I had to go to a different oral surgeon to do the implants. And I don't remember to this day who did the crowns on them. But with the 2 that you've placed for me, it's you do it. The extractions, the implants, and the crowns. It's all done under one roof.
Yeah, it's just the evolution of dental implant care in dentistry, right? Technology and education really moves at light speed. So 30 years ago, it was hard to find out how to do this kind of stuff. But now with education readily available, someone can learn how to do dental implants, but it takes a lot to be really good at dental implants, right? I think that there's a lot of people who can dabble, And for single implants, you can dabble in implants and be pretty good at them. But for full arch dentistry, the reason why I opened a practice that only does dental implants is I didn't want to dabble. I was tired of dabbling. I had done that for a bit, and I'm trying to split my time. I think it's really important if you're getting full arch dental implants to try to go somewhere that does this all the time, right? Not somewhere that does it once in a blue moon.
Once a week, once a month.
When I first started, I was at an office that kind of did it, couple a month here and there. But the difference between that and going to an office that this is all they do is night and day. And so going to an office where the dentist, the team, the staff is extremely well-versed in full arch dentistry, incredibly important, right? You're getting care in a sense that they do that all the time. It's all they do. And everything's kind of dialed in. So definitely, I think for people looking for where to go, that's an important thing to look at.
And we had a patient the other day that in the years that we've worked together, it was the first time anybody has asked, how many implants have you placed? And the both of us looked at each other and just started chuckling. And it's like, that's why nobody's ever asked that question before.
Yeah. And at this point, I've lost track. I don't know. My answer for people is I've done solely dental implants for 3 years. So hopefully it's a good amount. Otherwise, I would have been really bored that whole time.
I know it is.
But yeah, I think that's important. And I think that brings another topic that I think is very common right now and very common when I see, like I go on these dental Facebook groups, right? And it's, where do I go to get my implants? And there's always one of those comments that's, did you check Tijuana? Did you check Turkey? And so I think that talking about foreign dentistry, especially foreign full arch implant dentistry, is hard because I know clinicians who work in Mexico that are absolutely excellent surgeons, right? They are top notch. They do amazing care, but there's a lot of dentists in Mexico, and it is really hard for a patient to know where they're going, right? It could be really good, could not be really good. We've heard horror stories in our office of people coming back and, they want us to fix cases. They want us to finish cases because where they were going can't finish them. But at the flip side of that, there's people that are incredibly happy with dental implants from foreign countries. So it's a really hard topic to talk about with patients because I can't lump it all into one group, right? I can't say never go get your implants done somewhere else. But what I can say is it's going to be really hard for you to know if it's a really good place or not. There's going to be a lot of travel involved. Be ready for that.
Yeah. So I always ask them, you do realize there's a lot of post-stops.
Yes, you're going to be traveling back and forth. And, if you live in Arizona and
easier,
you can drive across the border, it might be a little bit easier. But if you're flying to Cancun 6, 7, 8 times, it's a lot. So it's hard. It's something that I think we're seeing more and more of in full arch dentistry is this drive to, hey, I'm just going to go somewhere else and get it done. And, it's hard as a dentist in the U.S. because I don't want to just be like, we're the only people that can do this. But at the same time, I see horror stories from my end and I see horror stories from colleagues of mine. And so it's incredibly challenging, I think, finding and knowing when you're going to a foreign dentist, a foreign country, knowing what kind of product you're getting.
Yes. Another question that I get is, are my teeth going to look fake?
Yeah.
I don't want them to look like they're dentures.
Yeah. Well, I think, a little earlier we alluded to technology, and a little earlier we alluded to kind of the old way of doing stuff. And the old way of doing stuff was we would literally take a denture. Sometimes if the patient had a previous denture, we'd take that previous denture, drill some big holes in them. And when we placed those implants, we would pick that denture up in those implants, grind it down. But it was a denture, right? I did it that way for a little bit of time. Now we do it a different way. We design those teeth digitally. We print them with a 3D printer. We make them pretty by hand, and they look really nice and really real. And they're strong and it's not a denture with some holes drilled in it, right?
Right.
But there are a lot of places that still do it that way. And so there is a big range of what it's going to look like depending on where you go. It could look like a denture, or it could look a lot more aesthetic. And it's just, it comes down to, how that's being done.
That's always been one of your things, is you want them to look as good as possible.
Yeah. And I think, there's kind of this joke sometimes in dentistry that make the temps not look as good so they come back, right? But I don't believe that. I want people to, as soon as we get those implants in, as soon as they get teeth in, I want it looking as good as we can. I want them happy, excited, smiling. I don't want to have them have teeth that they're not super happy with for 3 more months until we get the finals, right? Like, I would rather initially, right off the bat, people be incredibly happy. And then when they get the finals, they're even more happy, right? They got even stronger teeth that look even better and can chew even more. But we give them the best possible as they're healing.
And of course, we've kind of answered this already too, is, will I be without teeth?
Yeah.
And that's not, we don't want that to be an issue.
No. And I again, going back to traditionally, right? Before loading dental implants same day was a thing, it was, you're in a denture for 6 months, 8 months while implants are healing, right? Or we're going to sinus lift in there, wait 6 months, then denture for 6 months, then you get teeth, right? And like everything, there's still people that do it that way. But I think that with technology, with, advanced implants, getting patients' teeth the same day that they're getting those implants in, like 24 hours of getting those implants in, making sure they're going through that healing process with something comfortable is incredibly important, right? Yeah. And I think that that's what people want. I think dentistry-wise, it makes my life easier knowing that patient is comfortable and happy. So, yeah, every single patient, our goal is teeth within 24 hours.
Very good. And it's, I know we pride ourselves in that. One of the other things that I think is a very positive, very unique thing about our office is it's your office. Mm-hmm. This is not a chain. We're not part of a DSO, dental support organization, that you and or I have to answer to, which makes the environment quite comfortable to work in.
And I, full arch dentistry, implant dentistry is incredibly popular right now in dentistry. It is the hot thing. There's a lot of money flowing into it, often from corporations or private equity groups that are funding these kind of big corporate chains who do this. And probably everyone who is looking to get this done has probably been to one of those places.
At least one.
And yeah, so for me, I wanted an office that was mine, that I ran my way. But, I had experience with corporate dentistry. You had experience with corporate dentistry, right? How would you say it's different coming from, you worked for a couple different corporate companies before coming to me?
How is it different? Good Lord. The atmosphere is much more comfortable. Mm-hmm. We are able to make decisions for our patients based off of what we want to do, mm-hmm. as opposed to what a regional or a district manager is telling me. It's just the corporate offices that I've worked for, they were each person that I had to answer to had to create their own little fiefdom and just to justify their position. So there was a lot of bickering going on with people, a lot of, I need control over this. And by not being in that atmosphere, an environment, we're able to control things so much better for our patients.
Mm. Yeah, I think that it's important that first and foremost in everything is, patients come first, right? And that's why, I opened an office for my patients, for my team as well. I wanted you I wanted my dental assistants. I wanted everyone to work in an environment where they felt like patients came first and they felt like, they had the ability to do what they want and what they felt was best for that patient. And I think that's important. And I think that, there's a full arch dentistry is expensive, right? And there's a lot of cost involved, but there's also, people make money from it. And so it's very quick for a corporation to come in and say, we're going to make a lot of money off this. We're going to, maybe cut costs as much as we can. We're going to kind of get as many patients as possible, kind of go through them as quick as possible. And I think that this type of treatment relies on so much care and trust, and it can't be a speed thing. It can't be a assembly line, right? And I think, care and time with each one of our patients for this big of a procedure that someone's doing, this big of a change in their life is incredibly important.
It's a commitment.
Yeah.
And everybody's got to be committed to it. One of the other things I think at least in our office, each employee feels that they can voice their opinion, that they're going to be heard from and valued. And I mean, that's just the way I've always managed people. I don't know everything. And I'll be the first one to tell you I don't know everything. I came to work for you and didn't know. I had implants, but I had never heard of all-on fours. It was a heck of a learning curve. But it's also been extremely satisfying because we get to change lives.
Yeah, absolutely.
And help people that didn't think they had any help. And that really means a whole heck of a lot to me. And I think the whole team.
Yeah, I think that, from an office perspective, right, we see a lot of patients. But from a patient perspective, this is
their only office.
This is everything, right? We're their office. They come to us. They see us a lot. And so for our team and us, remembering that, this is such a huge thing in people's lives, and just treating that with care and kindness and making sure people feel comfortable is so important. And I want my team to feel that as much as I feel that, as much as you feel that.
Yeah. And it's a great satisfaction to be able to do what we do.
Yeah, absolutely.
Whether it be, even the single implant, somebody who's lost a tooth because of a bar fight, and they're embarrassed because they don't have their front tooth, or again, a failed bridge, so they're not able to eat. It really does mean a whole lot to us.
Yeah, for sure. It's definitely, it's impactful, and it's good that everyone remembers that. Like, we do a lot of full arch cases, full mouth reconstructions, but even a single implant on a back tooth to someone could mean a whole heck of a lot. Being able to chew again on that side. So nothing we do is small. Everything is important.
You had mentioned modern implant technology and how it's changed our ability to get people their healing teeth within 24 hours. Do you want to discuss some of the ideas that go behind that, the pterygoids, the zygos?
Yeah, so I think what you're alluding to is advanced implant placement, right? Which is just another step in what an office can do. So at our office, we do kind of traditional implant placements, but I can do advanced implants if people need it to get more support for those teeth, because a lot of people come in, they might have been in denture for a long time or missing teeth for a long time.
And they've got bone loss.
And yeah, for those people, they might have a whole lot of bone loss. And kind of the traditional implant placement techniques might not be enough for them. I don't want to put teeth in someone's mouth and they only have the front 6 teeth and that's it, right? That doesn't accomplish anything. So from there, we go to advanced placement techniques. We're talking implants that are placed kind of outside the normal envelope of where they're placed. It takes advanced training to do. It takes, advanced techniques to be able to do that. But what it allows us to do is see more patients, help more patients, help people that, maybe they've been somewhere and told that they
can't do it.
They can't do it, or they've been told, hey, you need all this grafting. It's going to be a year. That's a pretty common one. And it's pretty often like we can go in there and say, you know what? No, we can get implants in there same day, kind of same timeline as everyone else. We just need some advanced implants in there to do that. So that's something that, from my side, learning to do those, getting proficient at those has been incredibly important in just helping as many people as I can, right? Making sure that someone doesn't come into the office and I have to tell them no, because I don't want to have to do that for someone. So yeah, I think that's incredibly important, and then a big part in what we're able to offer people.
Yeah, it's amazing how many second, third opinions that we get too. I was told I can't. I was told I can, but, and that all comes back to a big part of my job is to make sure they've got all the information they need to make the best decision they can for themselves. That's what we're here for.
Yeah, absolutely. I think that first and foremost, that consult appointment is us going through their x-rays and everything like that. But a huge part of it is just answering questions.
Yeah.
Making sure patients know what they're getting into, what the process is. I don't want this whole process to be mysterious, right? I don't want someone going, I go to my dentist in 2 weeks. I don't know what they're doing. I don't know how long it is till my teeth are. I don't know what stage of the process we're in. I just show up. Some people might be like, yeah, right. But I want my patients to know as much as possible before and during this treatment. I don't want it to be, a mystery. So we do our very best to make sure that people understand. And I mean, that's why we're sitting here doing this today.
I don't like surprises.
Yeah.
And I don't know, surprise parties, maybe. But when you're talking about medical or dental procedures, I sure as heck don't want a surprise.
Yeah. And I think, I see it, I spend time, I go on Facebook, I look at these dental implant groups for patients. I read through what people are saying, and there's a lot of people out there who are in the middle of the process and have no idea what's going on, right? They're asking questions on there, and I'm like, your provider you should probably reach out to your provider. They'll tell you. But I don't want people to be confused. And I know, we're coming at this from, we work in a dental office, right? But what I want is every patient that steps in to our dental office or any dental office looking for dental implants to know as much as possible.
Yes. 100% agreement from this side. So, Doc, another question that I've had and that when I'm interacting with our patients in consults is, what about a snap-in? Aren't those just as good? And so can you talk about the difference between an overdenture or a snap-in denture and the fixed arch?
Yeah. And I think it's something that a lot of people are confused about, right? A lot of our patients, initially just say, oh, I want a snap-in denture, but they might not know, fixed teeth are an option. They might not understand the difference. So we do both in our office. We offer both to our patients. What a snap-in denture is it's 4 implants usually. And then we place a denture in there, and just a normal denture that they're going to heal with while those implants are healing
and integrating into the jaw.
Yeah, under the gums. And then eventually those implants around that same 4-month timeline get attached to that denture, so that denture can snap in and out. And what I tell people is it's still a denture. It's still made of the same material as a denture. You're going to take it out at night just like a denture. It's going to have kind of the piece that goes between your lip and your cheek, just like a denture, but it's going to be a denture that's a lot more stable. It's going to be a denture that has implants holding it in place so that it snaps in and out. So when you're laughing, it's not going to fly across the room. So it's a very upgraded version of a denture. But if we're talking about gold standard, our gold standard is those all-on-4, all-on-6, all-on-X, fixed. There's a lot of names for it.
Yeah.
Fixed implants. Teeth that don't come in and out that are screwed into those implants. Big plus is it's made of a stronger material in that zirconia. It's made of something that you're going to be able to eat and chew with. You're not going to have to take it out at night. It's not going to be kind of big and bulky in there like a denture would. So we do both options, but we tend to do much more of the fixed implants, because when we kind of describe the differences for people, if we can, we do that option, because I think that people end up being a lot more comfortable. We have people that like their overdentures too, but it's just not as common in what we do,
Right.
because it's just not really, it's not the best option that we can do.
Yeah. Well, it's with the fixed, everything's back on the menu.
Yeah.
And eating is not going to be a concern for them. And I think that's a big concern for a lot of people, is what am I going to be able to eat again? I want to be able to chew peanuts.
Yeah.
I want to be able to, eat a good piece of steak.
Mm-hmm.
I want to bite a piece of apple off of the apple and not have to slice it up before I try to eat it. Those are just some of the few that I've had people talk to me about, and it's like, we take so much for granted, but darn, yeah.
But I think the flip side of that is, we might not do a lot of overdentures, snap-ins. We might not do a lot of regular dentures, right? But I think it's important that we still do them, because there's some places where all they do is fixed implants, and not everyone can do that, right? Mm-hmm. It's not the best option for everyone, even if it's down to it may not be a financial thing, it might not be a bone thing, it might be a other factor, dexterity thing. We've had patients that
Right.
Weren't able to clean under those fixed teeth, but taking the denture in and out was something that they could do, right? And so we did overdentures there. So I think it's important that we do offer different things, and it's not just we only do one thing. We might do majority of one thing, but we still offer that, because not everyone is in the same situation. Not every patient needs the same thing. And I think shoehorning someone into one treatment option, you run into the same problem. Even if you're only doing that top option, not everyone's the same.
No, and that's part of the whole discovery process, trying to understand what it is the patient is looking to accomplish, what's important to them, and how we can make that happen.
Yeah.
But no, you can't paint everybody with the same brush.
Absolutely. I think that's important, and that just goes back again to going to an office that kind of does this solely, right? Or not even solely, but just does dental implants, all dentures, all this kind of stuff on a regular basis, is they have the experience to do everything for you. It's not just only one thing available, or we can only do this.
Right.
Yeah.
And another thing that with the years that you and I have worked together, we came from, as you said, the old school, with the alginate and impression materials and all that fun. And now our office is nothing but digital. We are extremely technologically advanced.
Yeah.
And it's really neat to be able to say to somebody, if something happens to your healing teeth, I can print you a new set in about an hour.
Yeah.
You're not going to be waiting for somebody to cast them and mold it and all that. And that also gives us the ability to be very flexible when it comes to alterations and changes to them.
Yeah.
We've got that ability to do it, and do it quickly.
Yeah. I think that, technology, and especially dental technology, moves at lightning pace, right? 5 years ago is completely different than now, and 5 years from now will be completely different. But I think it's important that, you stay nimble, you stay on top of it, because there's new technology coming out always, and we're always trying to find the best thing that's going to help our patient better, make treatment better. Whether that's scanners, whether that's 3D printers, whether it's all the fancy machines that we have that make a whole bunch of noises. We have everything to make it as smooth and comfortable as possible, right? But it's always going to be changing. So I think it's important we stay on top of that, because you're right, it does make life easier for our patients, right? If we can, say, hey, I want these teeth a little bit more round. I want them a little bit longer. Okay.
A little bit shorter.
We'll make that change. We'll print you a new set. We'll try it in and see how you like it. It's not, I need that. Okay, give us 3 weeks.
3 weeks. Yeah.
we'll have to make a whole new denture, reprocess it, repick it up. That's a long process, right? Or you're not trying, teeth set in wax in that are melting as you're trying to. We've been through that. Right?
I remember those days.
Yeah. So that technology, not only does it make my life significantly easier, but for the patient, it's a lot more comfortable of a process.
Very much, and it's great to be able to offer that to them.
Yeah, absolutely. Well, I think that's all we have for today. Hopefully that helped everyone out there know a little bit more about dental implants. Hopefully it answered some questions you might have. Being that this is a podcast for dental implant patients, right? We're probably not going to be an every week type of tune-in podcast. No one's listening to us on the way to work. But hopefully this is helpful to someone out there, answer some questions for someone out there, make sure that someone out there goes into their next procedure or goes into their next consult or even starts thinking about the dental implant process and knows a little bit more, kind of knows what to expect, what to look for. And that's really the goal, right? We want people to be as knowledgeable as possible, because I don't want, dental implant treatment to be secret. I don't want it to be something that, only the dentist knows and you just have to trust that they're going to tell you what's right. And, you go somewhere else and they tell you something completely different. Well, who's right? I want someone to take everything from this and hopefully glean as much knowledge as possible from it, but also know that, every provider is different, right? This podcast, me and Matt, we're talking from our perspective, in our practice, but that there's never only one right way. But my goal is to make sure that I'm giving you all the knowledge that I have to hopefully help you make your decision a little bit better. Hopefully help come to that decision, whether you're here in town and are just watching this video because you're interested in our practice, or whether you're 1,000 miles away, you're never going to come to Columbus, Ohio to get dental implant treatment, but you are about to walk into a different office and you want a little bit of knowledge before that. No matter who is listening to this, I'm hopeful that it's helpful for you. Yeah. Well, thank you very much for coming on.
Thank you for having me, as always.
All right.